Understanding bracket prescription. Now, bracket prescriptions are numerous, starting from edgewise all the way down to MB5. All it differs is the brackets themselves, but what's the difference in these brackets? It's the tip, torque, in-out, rotation, and slot. These 5 components are what makes a bracket prescription. The tip itself, as you all know, is the relation between the wire and the bracket in which it will tip the tooth either mesially or distally. Now, this is done by changing the relationship of the slot towards the bracket itself. So by bending the slot itself, you can bend it 0 degrees, 4 degrees, or 8 degrees, as you see in these brackets. Of course, the range is from 0 up to 13. And why is this bracket tip important? And that's because every tooth has a unique amount of tip that's different from other brackets or from other teeth. And that's why when we go back to the difference between Roth and MBT, I'm not going to go in this lecture into the specifics of Roth versus MBT. I've got another video on that. But here we'll just have some highlights. If you notice that mostly the tip is in the anterior teeth, the incisors and the canines. The premolars and molars generally have no or little tip at all. So most of the tip is in the incisors and the canines. And you'd notice that it's mostly in the upper rather than the lower. You'll also notice that the MBT has less tip. It's got 1 degree less here, 1 degree less here, and 5 degrees less here. That's a total of 7 degrees less tip. We'll come to that later. And in the lower, 2 degrees less, 2 degrees less, 4 degrees less. That's a total of 8 degrees less. So MBT has less tip. Okay. So how does actually the tip work? How does it work? It works when the wire is bent against the bracket, it's going to apply force. And this force depends on the wire itself. How much can the wire generate of force? And this force is multiplied by the length of the arm so that we get the momentum. The length of the arm here is the width of the bracket. So this is the width of the bracket is multiplied by the amount of force, which gives us the amount of momentum that's going to tip the tooth mesially or distally. So that's how it works. So what are the factors if we want to increase or decrease the amount of stiffness? I mean the amount of tip. First, it's arch wire stiffness. Now, the stiffer the wire, the more it's going to generate force. And since force is a major component here, the more you do, the thicker the wire, the more force you get. So arch wire stiffness here is a very important component. So this means if we can get a larger wire, a heavier gauge wire, it's going to do more tip. If we can go for TMA or stainless steel wires, it's going to deliver more force. That's provided that it's possible in the clinical situation. Also, the bracket width. And for the bracket width, you've got the wider the wire, the wider the bracket, the more the tip. Because as I said, if you want momentum, the momentum is the amount of force generated by the wire, multiplied by the width of the bracket itself, which is this is the arm, the length of the arm. So when you have narrow brackets like these, they generally provide less control on tipping. And this is something to look after because nowadays there are so many people that like these narrow brackets because they're aesthetic and because they have a wide interbracket distance, allowing for cleaning, and so they're nice. But in cases where you need tip, then you should think about the bracket width. Probably not on all the brackets, but if you've got a bracket on one tooth that needs more tip, then this tip is generated more if you have a wider bracket. And a double width bracket generates double the momentum. So it needs less, half the amount of force. So that's why wider brackets are very appreciated when you're thinking of tip. So I would think of those, especially in canine brackets, in extraction cases where I need to control the tip. I'd rather go for a wider bracket rather than a narrower bracket. But if the tooth is generally okay and doesn't need tip, then these narrow brackets, they're fine. Self-ligating brackets, which are very narrow, they're fine. But not in extraction cases, not in places where I need to control the amount of tip. The arch wire size is, of course, very important when it comes to the amount of force it delivers. But as size itself, it doesn't really matter that much. You can see that the wire, if it tips just 1 degree, it's going to close with the bracket. So the size of the wire itself isn't really that important. What's more important is the stiffness and not the size. Same thing goes for the slot. Should we use an 18 slot? Should we use a 22 slot? Doesn't make that much difference. For the wire engagement, it doesn't make a big difference if you use a narrower wire, a heavier wire, an 18 bracket, a 22 bracket. It doesn't make any difference. The difference is going to be for an 18 bracket with an 18 slot, 0.2% the angle of the play. Whereas in the 22 slot, it's 1.6 degree. So 1.6 degrees is very tolerable. It's not that much. So it's not that much at all if you have a 1.6 degree of play. In this sense, then if you really need to use wires, it's not important if you use smaller wires or use 18 slots. What's more important is that you have a stiff wire. So if you can use, let's say, a stainless steel wire that has a narrower gauge, it will allow more sliding than if you use a night-tie wire that's a heavier gauge. So that's the bottom line for the tip. In summary, if you're using a stiff wire, which is undersized, then it's undersized to allow for the sliding of the tooth, and it's stiff and strong to provide more force. If we use wider brackets, and what I mean by wider brackets doesn't have to be all the brackets, but the brackets that we want the tip to act on, they should be wider brackets. And if they're generally 22 slot brackets, and that's why to allow for the play so that these teeth can slide. So in general, for tip to be expressed, you need these 3 factors. Now, I'll give examples. Now, when we're using leveling, and these are in non-extraction cases, in many cases, you'll find that the canine is distally tipped. And if you insert a flexible wire, which is generally, let's say 14 night-tie or 16 night-tie, and you want to level these teeth, what happens is that it generates a momentum. And this momentum is going to try to rotate the tooth in a counterclockwise rotation. But this counterclockwise rotation, what it does is it moves the root backwards, move the crown forwards. Since we know that the crown moves much more readily than the root, what happens is that the crown moves mesially more than the root moving distally. And since this is something we don't want, we actually don't want to move the canine crown mesially, then what we do is we use lace backs. In these lace backs, we're going to attach the molar, premolar, and the canine and just tie them very tightly. You can use them in non-extraction cases. You can even use them in extraction cases. What the general principle about them is that they're going to prevent the mesial movement of the canine crown mesially. And that what happens is, since they've fixed the crown, it's going to allow for the root to move distally. But that isn't without cost. Yes, the root will move distally, but as the root is moving distally, this lace back is preventing this crown from moving mesially. But it is actually moving mesially. It's going to pull on these teeth. And this pull is going to cause some loss of anchorage. And that's something you can't get away from. So as you're leveling, you're actually losing anchorage. And this also happens for the incisor brackets. The same phenomena which happens for the canines happens for the incisor brackets. As you tip them, what happens is you're trying to pull these posterior teeth forward. So this loses anchorage. So that's why in non-extraction cases, little tip is better. We don't need that much tip. And that's why MBT is about 7 degrees less in the upper and 8 degrees less in the lower. We don't need the extra tip built into the Roth brackets. That's in non-extraction cases. Most of the cases, you just don't need the extra tip. So I would go for an MBT bracket, and I think that this MBT bracket will be fine in most non-extraction cases. And even if you went for an MBT bracket, it's important to know that the loss of anchorage or the expression of the tip, it happens very early in treatment, because it doesn't make any difference whether you're using a night-eye wire or a stainless steel wire, round or rectangular. The tip expression is going to work. The minute you place the bracket, the wire, it's going to push this crown mesially, push the root distally, and it's going to drain your anchorage. So in sensitive times, when you really don't need to, you don't want to lose anchorage, sometimes it's preferable that you add a TAD very early in treatment and just ligate this canine so that the canine crown cannot move mesially. And by this, you just control the amount of loss of anchorage, because a lot of cases, you lose anchorage because of the mesial tipping of the canine and the anterior teeth very early in treatment. And you find that, oh, I've got a bimaxillary proclination of the patient when he started off with rather flat teeth. And that's because you're using high tip patients, brackets, which are generally Roth brackets. So you either use MBT brackets, or I would prefer you put a TAD and you just anchor the canine. Or the simplest form is just to use a lace back, but it is less effective. So these are the extraction cases. When you have an extraction case and you generally retract the canines, I'm going to show you an extreme case in which you retract the canines and you've got distal tipping. Now, this case was not treated by me. It was treated by a removable appliance. And as you can see, there's a lot of distal tipping, but it's a nice case to show, to give the idea that when you retract canines, you generally get distal tipping. And distal tipping of the canines isn't without cost, because this severe distal tip is going to cause the roller coaster effect. This roller coaster effect is as this canine moves backwards, what happens is that it's going to move the incisors downward, because this tip in the bracket is going to push the crowns down, push this wire down, and it's going to push it like this. And it's going to cause this arc because it's going to push the premolar up, incisors down, cause this roller coaster effect. So what here in this case, Roth brackets are beneficial because the canine has a built-in tip that's 13 degrees. That's 5 degrees more than the 8 degrees of MBT brackets. Even the anterior teeth have more tip. So that's where you actually need these Roth brackets. In these extraction cases, this extra tip is going to be very helpful so that you can upright the canine and just keep it instead of this phenomena happening. Of course, this is just part of the story, but it is an essential component that is quite useful. Second part is the torque. And the torque of the bracket is generally, as stated before, it's the relationship of the wire versus the slot of the bracket. And it's going to generate a momentum that's going to rotate the tooth either buccally or lingually. Of course, there's negative and there's positive torque. Positive torque is generally when you push the root lingually and the crown labially. And negative torque is when you generally push the root labially and the crown lingually. Now, bracket torque in general, when you see a comparison between Roth and MBT, you'd notice that all the torques are negative, meaning that all the roots of the teeth are labially directed and the crowns are lingually directed, except for the upper incisors. They're the only ones that have a positive torque. All the others have a negative torque. This is something important to understand. Another thing is that in the MBT system, to compensate for the loss of the tip, what they did is they increased the amount of torque. And as you can see, that the amount of torque in the upper incisors is more. So that's the basic philosophy of the MBT system. You have more torque in the upper incisors, which is going to be helpful in the coming slides. Now, the torque inside the brackets, you'd notice that when you look at the faces of the brackets, they're generally the same. They're all vertical with all horizontal slots, but the difference is where is in the angle of the base here, the angle of the base. And that's why they say it's torque in the base of the wire, of the bracket. Not going to go into details about that, but that's the general phenomena. So when you notice, when you look at these brackets, they look from the faces, they're the same, but you look at the base here and you've noticed that they're not the same. There's a huge amount of difference. Here's a 17 degree and here's a 0 degree. So how does the torque work? Now, torque works the same way as tip works. When the wire hits on the sides of the slot, it's going to generate force. And this force is going to be in opposite directions. And this is multiplied by the distance between the contact points. The only difference is that in tip, the width of the bracket was the length of the arm, which is around 4 millimeters. Whereas here, the length of the slot, the diagonal length of the slot, is the length of the arm, which doesn't exceed 0.8 millimeters in an 022 bracket. So this means that this is so small, it's about 5 times or more smaller than the width of the bracket. So to generate the same amount of momentum, you'll need a lot more force to torque a tooth. You'll need about 5 or more times force to actually torque a tooth than to tip a tooth. That's why you see in generally leveling, anybody can do leveling. You just put in any wire and it does the tip. But when it comes to torque, it's difficult. A lot of dentists struggle with torque. Torque expression isn't as easy as tip expression. And the whole reason why is this length of the arm. It's so small. So you need so much more force to compensate for the amount of the length here. So you need 5 or more times more force. So what are the factors to play here? Well, generally, same factors, arch wire stiffness. The stiffer the wire, the more the force. So if you've got, let's say, stainless steel wire, it's going to generate more force than a night tie wire. That's why it's said that night tie wires generally are very poor torquing capability. They don't torque that well because the amount of force they generate isn't that much. If you want to torque, then I would prefer using a TMA wire or better than that, using a stainless steel wire, because stainless steel wires, they are stiffer and they apply more force. And this force here is very required. The second thing, which is not the same as in tip, is the amount of play. The amount of play between the bracket and the bracket slot and the wire in a 1925 wire is about 10 degrees. In a 1622 wire is about 20 degrees. This is huge. It's not like in tip. That's why this is a huge amount of loss of the torque. And of course, it works both ways. It works in the way when we're giving a positive torque or when we're giving a negative torque. We lose both ways. So that the play, it works both ways. And this means that an incisor can be tipped 10 degrees labially or can be tipped 10 degrees lingually. And it will still be the same. It will be within the limits of the bracket. There's no difference between that. It's just the root that's away either lingually or labially. And that's why there's a huge amount of play. And this amount of play is the biggest problem in torque. What about arch wire size? Well, for torque, we need the wire to be as much as possible fitting inside the slot. The more the width of the wire, the more the fitness of the wire, the less the amount of play. And therefore, it's going to express more torque. At the same time, the wider the bracket, the wire, the stiffer the amount the wire is going to be. And when it's going to be stiff, it's going to also apply more force. So what about the depth of the slot? Well, generally the depth of the slot shouldn't be a problem. Most of manufacturers would actually manufacture an 028 or an 030 slot depth. But this sometimes is not true. I've noticed that some of the low-grade brackets, the cheap brackets, you have them rounded here. So when you put a full-size wire, the wire just keeps sticking out here. So when it sticks out from here, it doesn't go inside the slot. And when it doesn't go inside the slot, what that means is that you're actually not expressing the torque as it should be because it's not tight fit. So here, the slot depth matters. But if it was an 028 or 030, it's fine since the majority of our wires don't exceed 025 as a depth. So depth is just stay away from poor brackets. What about slot size? Well, generally in slot size really matters when it comes to torque expression because you need to fill in the slot. So if you're going to fill in the slot with an 18, putting an 1825 wire, you've got a play of 1.2 degrees. But we said 18 by 18. Why is there a play? Yes, there is a play because manufacturers generally make brackets not 18. The slot is just a little bit larger than 18. And the wires, they generally make them just a little bit smaller than 18. So in my practice, sometimes I would put an 18 bracket and I can easily fit a 1925 stainless steel wire inside an 18 slot. Although it's a 1925 stainless steel wire, but it still can go inside an 18 slot. Sometimes it needs a little bit of pressure, but still it can go in. So there's a little bit of play. But you've noticed that if you use a 1622 wire, you have about 7 degrees of play. When you come to the 22 brackets, it's about 11 degrees for an 1825 wire and about 20 degrees for a 1622 wire. What that means is that when you really want to express torque, it is much better to use an 18 slot bracket so that wherever wire you put in it, the amount of play is going to be much less. However, you must consider that the stiffness of the wire is also a major important factor. So if you're going to put an 18 slot bracket and use a 1622 wire, then you're actually compromising the stiffness. Or should you use a 22 bracket with a 1925 stainless steel wire, where here you have a lot of stiffness and the fitness is the same. So if it's between a 1925 stainless steel with a 22 slot versus a 1622 with an 18 slot, I'd go for the 22 with a 1925 stainless steel because of the extra stiffness of the 1925 stainless steel. But if you're going with an 1825 stainless steel or 1622 and you won't change the wire, then placing an 18 slot bracket is going to express more torque. This is very important if you're going to do it on just one bracket, not all the brackets. And this way you can express more torque on this bracket than you can express them on the others. So the last thing is overcorrection. And as you can see, this is just a classical class 2 division 2 case. And once you start to level them, then it's a piece of cake. What you want to do is just to procline the incisors and retrocline the lateral incisors. So that shouldn't be very difficult. And what usually happens is that when you finish up the leveling, you find that the centrals, they're still under torqued. And the laterals, they're still over torqued. Why is that? Why? They're generally aligned. Why is it that we still have a lot of torque issues? Well, that's because of the play. It's because of the play. Because you don't generally use 22 wires in 22 slots. You generally use 19, you use 1622, and this is going to compromise the amount of torque expression. Show you another case of mine. This patient came and she has a central incisor which is proclined. So you can see this is much more proclined than this one. This is more upright and this is proclined, these two centrals. And this is about after 3 or 4 months of leveling, you can still see that it's much better now. The alignment is much better, the occlusion is much better, but this is still proclined. Look at it from the side. You can still see that this left central is more proclined than this one. This one is more upright. This one's more proclined. Why? Many of the dentists, they would just put in the same bracket on all the teeth and expect them to work differently. They'd expect that this bracket will correct the torque and this bracket is going to correct the uprightness. They don't do that. And the reason why they don't do that is because of the play, which I showed you earlier. Here there's a play keeping it from uprightening, and here there's a play keeping it from proclining. So you should think of that. When you've got teeth which have different torque to start with, you may need to have a strategy towards torque. You may need to make this one with less torque. So the left one, if we want to have less torque on it, we probably would use a Roth bracket on it. And just keep this one as an MBT one. This MBT one will have 17 degrees. This one has 12 degrees. It's going to push it a little bit more in. Or probably, if we want more torque on this one, we would put an MBT bracket on it so it can procline it. Or we can use an 18 slot bracket on this one so that it expresses the torque more. So if we put an 18 slot bracket here and an MBT bracket, it's going to procline the tooth more and bring it with this one. So that would be your clinical judgment of every case. So in summary, if I want more torque expression, I should go for a stiff, oversized arch wire. The more oversized and full filling of the slot, the better. And if it's stiff and stainless steel or heavy wire, that's even better. An 018 slot, an 18 slot is more preferable since it's easier to fill. Although it does mean that I will have to use undersized wires to use an 18 slot. But if I use 18 slot brackets on single teeth, it's very useful. And lastly, overcorrection. And what I mean by overcorrection is not just 5 degrees of overcorrection. Because the tip, the play that is between the wire and the slot is a minimum of 10 degrees. When you're thinking of overcorrection of torque, you should think of a minimum of 20 degrees of overcorrection, because you've got already 10 degrees gone away because of the play. So the other 10 is going to be the active 10. Another thing is why we said 18 degrees of brackets, the 18 slot brackets. For this case, for example, you may see these, the canine and the incisors, they're generally of acceptable torque. The main problem is in the lateral incisors. If you put a high torque bracket here and you're trying to make the low torque bracket and you're trying to bring the root outward, what happens is that as you bring the root of the lateral out, the root of the canine and the incisors, they're going to go in. And this is just a normal response because it's an equilibrium of force. You bring the root of the lateral out, you bring the root of the central and canine in. But sometimes you don't want to bring the root of the canine and the central incisor in. If you put an 18 slot bracket here and a 22 slot bracket here, then if you put, let's say, a 1725 arch wire, a 1725 arch wire in an 18 slot bracket is going to generate a good amount of torque. But the 1725 wire inside the 22 slot is going to have a lot of play. It's going to be something like 17 degrees. So it's not going to affect the neighboring teeth as much as it would. That's why I said 18 slot brackets on specific teeth where you want to have more torque expression, they're very useful. In extraction cases, however, this is the principle of MBT brackets. They increase the torque on these incisors so that they can push the roots lingually. And as these roots are pushed lingually, then you're going to have a more straight arch wire. But they don't just push the roots lingually. They push the incisor crowns labially. This also drains the anchorage. So the same thing counts. You should count your anchorage. The same thing with the tip. But there's a difference here. With the tip happens from day one, from the night tie wire. So you needed to put probably a lace back or a tad and ligate the canine from day one. But when you have torque, torque is not the same. Torque is only expressed when you put heavy gauge wires, which are rectangular. And this comes very later on in treatment. So probably by then you would have already managed your anchorage, put in tads, used headgear, or prepared the arch for the more requirement of the anchorage. So that's why, although tip and torque, both of them drain the anchorage, the tip drains it very early, whereas the torque drains it quite late. And that's why it's less of a burden on torque. Another important tip to remember is as you're torquing these roots lingually, they actually come closer together. And sometimes they come so close together that they almost touch. So it's important once you've finished leveling and finished the torque control to take an OPG and just check the parallelism of these roots. And if you notice that because of the lingual torquing of the roots, they've come closer together, probably you'll need to change the tip here. And that's done by just a little twist, just rotating the brackets so that they would correct this tip. Another important factor is the height of the bracket. Where you place it changes the amount of torque expression very considerably. So you can notice that it's on just one tooth. If you place the bracket very low here, it's a high torque bracket. Here, it's a normal torque bracket. And very high, it's going to be a zero torqued bracket. So to make them work the same, you'll need more torque if you place it high and less torque if you place it low. Why is this so important? We generally place brackets in the center of the crown. Isn't that right? Well, most of us do, but not all of us do. Nowadays, there's such a huge trend to do smile arcs. And when you're doing smile arcs, then you're elevating the brackets on the central incisors and the laterals, especially the centrals, and you're pushing them way up. And that means that the torque here is being underestimated. If you put here a normal torque bracket, what happens is the amount of torque is going to be much less. So if you have a choice between the amount of torque, as with Damon brackets, if you put the Damon brackets in the middle of the crown, then normal torque is okay. If you place them low, then you can take a low torque bracket. If you place them high, then you need to use high torque brackets to do the same thing as a regular bracket placed in the middle. And that's something to remember, because if you place them up without putting the extra torque, you end up with lingual tipping of the incisors, unless this is something which you want for the clinical setup of that patient. The last three components, I'll go on them very quickly, which is the bracket in-out. And the in-out width of the brackets generally are, most of the brackets, they're the same. Just the upper second premolars in the MBT system, they're 0.5 millimeter wider. And for the lower incisors, they're generally 0.5 millimeter wider. The lower incisors, they're wider so that they push them lingually to gain canine prominence. And the upper second premolar is wider because of the in-out is wider. That's because the upper second premolars are sometimes smaller than the fours. So you need to push them a little bit lingually. However, you cannot escape lower incisors being having more in-out depth. But the upper second premolars, I generally don't like the MBT ones because they break off so oftenly. I'd rather use the upper first premolars or the upper second molars of the Roth system, which are not the thick ones, the thin ones, because they break. But they do a good job of pushing the 5 lingually, but I generally don't like them. And another consideration, sometimes if you want to use a lower incisor bracket, let's say in an upper tooth, whichever tooth you like, then you should think about the in-out depth. Another tooth that has an in-out depth problem is the upper lateral incisor. Upper lateral incisors, they also have thicker brackets so that they're pushed in lingually a little bit more than the upper central incisors. Fourth problem is bracket rotation. And bracket rotation, generally brackets have equal arms, so that when you place the wire, they're the same. There are brackets that have unequal arms, so that this one's longer or this one's longer. This means that the wire is going to twist as it comes in. And as it flattens out, it's going to cause some rotation. And this is generally, it was used by Andrews in extraction cases. Nowadays, rarely do the manufacturers make rotation in brackets. They rarely do that. But they commonly do it in molars. On molar buccal tubes, you always have an amount of offset, this one, which is an amount of rotational control of 5 or 10 degrees. So why is this important? Generally in extraction cases, if you retract, you get in the rotation of the canine in a distopalatal direction and rotation of the 5 in a mesiopalatal direction. So to overcome that, if you just place your brackets so that they're a little bit more lingual, more distal for the canine and more mesial for the 5, you end up with a counter rotation. It's going to just rotate these teeth back to normal. And it's going to make it much harder for this canine to actually rotate in a mesiopalatal direction. Just by positioning the bracket, instead of in the center, just a little bit more distally. And here, instead of in the center, just a little bit more mesially. And last topic is the slot. Should you use 18 slot or should you use 22 slot? We talked quite a lot about 18 slot and 22 slots, but I'll summarize that for 18 slots, full engagement is easier. You can place any slot, 16, 17, 18, it's going to fill in the slot. This is going to give a very good torque expression, especially if it's stainless steel wires, because they have enough force. So I would generally use them on selected teeth for torque. And I would select them for non-extraction cases, because non-extraction cases don't require heavy gauge wires. They don't require a lot of control. So even if the wires are thinner, in non-extraction cases, 18 slots are fine. But still, the amount of play and sliding is less. In a 22 slot, it allows for play, so there's sliding. It allows for larger stiffness or stiffer wires. So because it's so large, if you put a small wire, it's going to slide freely. If you put a heavier wire, it's going to be very stiff. So that's why this is very useful in extraction cases where you need stiff wires to control the occlusal plane. And in selected teeth for sliding, let's say you're a fan of 18 slot brackets and you like them, but for the canine, you can just put a 22 slot bracket. And this is going to make the sliding much easier. And I do remind you that the slot size has very little effect on the amount of tip, but has a huge impact on the amount of torque. So the take-home message of today is to choose brackets for teeth and not sets of brackets for dental arches. I thank you for your listening, and I hope you found this video interesting. In the YouTube channel, there are tens of other videos arranged into playlists as biomechanics, TADS, undergraduate and postgraduate lectures. I hope you have the time to go through them, and if you have any questions, please write them down in the comments section and I would be happy to answer them. If you found this video useful, please consider to like it and share it with your friends. You can subscribe to the channel and press the bell icon so that you can be notified of any future videos. This is a full playlist of the videos for undergraduate teaching, and this is the latest uploaded video. See you again in the next video.